Well, today's the second day of our CBS News 3-day investigation called Medical Price Roulette. We partnered with journalism company Clear Health Costs to take a closer look into the rise of healthcare costs. CBS News consumer investigative correspondent Anna Werner shows us how prices varied by thousands of dollars, sometimes at facilities that are just miles apart.
Last fall, Miriam Harper was 12 weeks pregnant when she lost her baby.
It's a reminder every time I get a bill of just emptiness.
Suffering a miscarriage was hard enough, but what made it worse was the bewildering mix of medical treatments and prices.
Bills just keep pouring in this lab and that lab.
Her first visit when the bleeding started was to a local birthing center. For the visit and 2 ultrasounds, it charged her $150. Later in the day, her symptoms worsened, so she went to the local county hospital. They, too, sent her home. But the next morning,
I got up to go to the bathroom and just collapsed. Was unconscious. My husband could not get me to come to.
Her family called paramedics who took her to Baylor Scott and White Hospital, where doctors gave her the same 2 ultrasounds. The bill for those?
$1,500.
$1,500?
$1,500.
So that's a multiplier of 10 times
Yes.
your first one.
Right.
Are you surprised by that?
Shocked.
Medical prices vary greatly, even within the same city. Take a look at the cash prices. Prices used here as a benchmark for comparison we found in the Dallas area when our partner Clear Health Costs surveyed providers. For a lower back MRI without contrast, the price goes anywhere from $295 to $5,323. A mammogram screening ranged from $139 to $743. And sometimes they aren't even very far away from each other. At Texas Health Harris Methodist Hospital, the cost for a cardiovascular stress test is $698. But just a mile away, a 3-minute drive, at Baylor Scott and White All Saints Hospital, the same cardiovascular stress test is priced at $8,217, a difference of over $7,000. Aaron Carroll is a professor of pediatrics and health services researcher.
It's because someone can. If someone is willing to pay it or has to pay it, then someone is likely to charge that amount of money.
Bay Area resident Mark Webb learned about medical pricing the hard way. When his doctor recommended he get a routine colonoscopy, Webb called the provider to make sure he knew the maximum bill he'd face.
They said that based on what your doctor ordered, it could be 3 different codes ranging in price from $1,300 to $2,400.
So you're okay with that?
I was. That seemed fine to me.
But when the bills arrived, the surgery center tab alone was $4,800, the doctor $3,800, and the pathologist an additional $300.
If they had told me that I was going to get almost $9,000 in bills, I would have either postponed it for a while longer or I would have gone somewhere else for the procedure.
Right, you would have shopped around more.
Definitely.
And just as in Dallas, prices vary drastically just a few short miles away. At Simon Med Imaging in San Francisco, an MRI of the upper back cost $550, while 4 miles away at St. Mary's Medical Center, the price was $5,751.
What's the rationale behind the pricing?
You have to remember that the people who are providing health care are also trying to make money. And so a lot of the rationale is, how do we drive revenue? How do we bring in resources so that we can, make a profit?
I think it's very erroneous to suggest that hospitals are wildly profitable.
Ashley Thompson is with the American Hospital Association.
Each hospital sets its pricing according to its own methodology.
So theoretically, they could charge whatever they wanted to for a test, correct?
What's interesting is that most people look less at what is being charged for a service and really are more interested in what they are going to have to pay out of pocket.
Right. But there's no rule or regulation that says you as a hospital, you cannot charge $10,000 for X.
There's no rules or regulations that I am aware of.
Mark Webb wound up paying over $4,000 out of pocket for his colonoscopy. Of the system, he says,
It's either unethical or dishonest. I'm not sure which.
Now, Baylor Scott and White waived Miriam Harper's bills through a financial assistance program, but she still owes money to the surgeon and another facility. St. Mary's Medical Center in the San Francisco Bay Area told us that the price for its lower back MRI in our survey was too high, but would not disclose what it says was the actual price. We've posted the hospital statements on our webpage, where you can also see the prices we found. Go to that website at cbsnews.com/health costs. And while you're there, please share your prices with us. Tell us what you paid. Click on that share and search prices button that you're seeing right there on the webpage and share your prices. Tell us what your prices were. And the reason we're asking for that is because although, Anne-Marie, we've done our surveys, that only surveys cash prices. Of course, insurance companies negotiate different prices. So we want to know from the audience, what did you pay? Because your price, especially if you have insurance, which most people do, will be something different. And guess what? The insurance companies and the hospitals won't disclose those prices to us.
No, they don't make that information available.
The way we're going to learn about what you paid is from all of you. So please let us know. And also, as I say, they can also search prices. We have two, we talked about this yesterday, we have two sample markets that Clear Health Costs journalists surveyed for us, and they surveyed the cash prices on 30 to 35 common procedures like ultrasounds, MRIs, and it just gives you a sense of the idea that, listen, if I need to have this ultrasound, this, or MRI of the lower back, right? MRI of the lumbar region is a very common MRI. It's given to thousands of people across the country. You can call around to different places and see how much that will cost you. You'll have to call your insurance company and say, okay, now, how much do you reimburse at XYZ place? But you can check for it's some work.
It is work.
But you know what? For certain things, if you have a high deductible, right, and you're not going to hit your deductible for that year, and one place costs $1,000 and the other place is going to wind up costing you $500, I'm talking out of pocket after the insurance pays.
It's worth it doing sort of that extra leg of research. But I just think, and we talked about this yesterday, you're needing a procedure or needing another scan. You're nervous about the idea of needing another scan. You just want to get the first appointment and get out.
That's true. And you know what? I've done that. Right? I mean, people say we're going to run this test and you think you have something going wrong. And you need an MRI to make you, and you want it that day, the next day, and your doctor can set it up for you at a facility that they work with because they have a relationship and you can get it. But you know what? I will tell you that a lot of times if you do call the standalone radiology center, I'm guessing a lot of them can get you in just as quickly. They have appointments available. If all they do is radiology at a center, standalone center, it's in their interest to get in as many people that day as possible. So if they have an appointment open, they're going to, they just have to get insurance approval. They have to call your insurance company.
Right, of course. So you got to do some of the work yourself. Like right at the very end, when you asked the woman from the Association of the Hospital about some sort of regulations that would at least put a cap, and she said she's unaware of it. Are you aware of that discussion popping up at all with lawmakers? I mean, is it even something that's on the radar?
It's a tough one, right? Because there's a lot of interests who are going to push back against that. Any kind of legislative proposal. The insurance companies, the hospitals, the doctors. Hospitals and doctors don't want to be told by somebody else what to charge. And they're going to say, look, this is very complicated. There's a lot of factors that go into this. One of the things that the Hospital Association said to us was a big part of their cost at major hospitals is labor. That labor costs, they have more, and they also have obligations that, for example, a standalone radiology center doesn't have. They provide an emergency room where lots of low income and poor people will come in. But here's what the experts say to contradict that. Some of the experts we talked to say, well, yeah, but they get paid. Medicare, Medicaid, they may not get paid what they want, but they get paid for those visits in the ER. And they also make a lot of revenue, even if they're non-for-profit. And they say, look around at the hospital campuses. Look at the salaries of the administrators, who some of them are making millions of dollars.
Money,
So there are other questions to be asked about, okay, do you need to make quite this much on these procedures?
Right.
And the negotiations, of course, which we're going to talk a little bit about in tomorrow's, our third part tomorrow. We're
like patient negotiating?
We're going to look, we're going to look a little bit at the negotiations on the prices between, hospitals and insurance companies. And, the deals that they're making and why those negotiated prices are secret. If you call your insurance company and say, I want to know what the negotiated prices are that you have with Hospital X and Hospital Y and Hospital Z, I don't think they're going to tell you, unless it's specifically about a test you need.
Anna Werner pulling back the curtain. I'm looking forward to tomorrow's last and final
and
installment.
Just a reminder to people, we
Get
posted
on that website and tell us what you paid.
Resources, how to fight a bill, 10 tips for fighting a bill, what questions to ask. Go read those resources, some of those written by our partners at Clear Health Costs. You can go to that button, and click the share and search prices. That's where you can share what you paid. You're going to go through a pass-through page where you have to click another button on a disclaimer page, and then you'll land on our CHC CBS joint page. Left-hand side, share what you paid. Right-hand side, search prices in our 2 sample markets, which gets very interesting.
I bet it does. Well, I will see you tomorrow, same time, same place. Thank you.